incontinence in women. Female urinary incontinence has not received the attention that some other gynecological diseases have, for various reasons, some of which are due to a lack of public awareness of the disease. Urinary incontinence is not a serious disease, but it negatively affects significantly the quality of life. Urinary incontinence types, causes, symptoms and treatments are many and different. Urinary incontinence treatment is available and greatly improves the quality of life. Urinary incontinence is defined as the involuntary descent of urine, and the inability of a person to control the urination process. It is a common problem in women, and it can occur at any age, but it increases in prevalence with age. Scientific studies have shown that urinary incontinence effects has a significant impact on the quality of life, in addition to the negative impact on self-confidence and the attendant negative effects on social and family life. Medical studies indicate that about 1 out of every 5 women over the age of 40 suffers from urinary incontinence. However, this is an estimated percentage, as there is a belief that the percentage is much more. This is because many women do not see a doctor for various reasons, including some feeling embarrassed to speak about urinary incontinence and the misconception of some women that urinary incontinence is a natural thing that occurs with age and their belief that there is no cure. The most common types of urinary incontinence. There are many types of urinary incontinence, and stress urinary incontinence and urinary incontinence resulting from an overactive urinary bladder are the most common. Urinary stress incontinence. It is urinary incontinence associated with coughing, laughing, sneezing or playing sports, and it can also occur during intercourse. Its causes are attributed to weakness in the pelvic muscles resulting from pregnancy and childbirth, weight gain, menopause in addition to advancing age. Urinary incontinence resulting from an overactive bladder. This occurs when the woman feels a sudden urge that cannot be ignored, and this often leads to urine dropping before reaching the bathroom. Other symptoms include frequent urination during the day, waking up to urinate at least once during the night, urinary incontinence associated with urinary urgency, and the causes of this type of urinary incontinence is not known in most cases, as it may occur due to diseases of the nervous system. Mixed incontinence. It is a mixture of the two types, and it is the most common type. How do women cope with the problem of urinary incontinence? To avoid the embarrassment that accompanies involuntary urination, some women deliberately limit their social activity and in many cases resort to shopping only in places where toilets are available, knowing that women are less willing to use public toilets than men. In addition, that some women who suffer from stress urinary incontinence leads to frequent urination to ensure that the bladder does not contain a large amount of urine when stress occurs, i.e. laughing, sneezing. The involuntary urination and the feeling of wetness motivate the woman to pay more attention to personal care, a lot of clothes, the use of feminine pads, and the consequent feeling of mistrust and its impact on work and social life. Urinary incontinence causes. Urinary tract infection or irritation of the vagina. Exposure to severe constipation, which causes stool retention, which affects the urinary tract and prevents urine flow. The side effects of one of the medications taken, such as pills that are taken to withdraw water from the swollen areas to the bladder, which speeds up the filling of the bladder with urine, and urine leakage may occur as a result, and many drugs contribute to the occurrence of urinary incontinence, such as some sedatives, muscle relaxants, and antidepressants. Excessive intake of caffeine-rich substances such as coffee, cola, spicy foods, as well as chocolate and diuretic foods, which causes bladder problems. Kidney or bladder stones. Advanced age. Weakness in the bladder muscles is observed with age, and this in itself increases the risk of urinary incontinence, and it should be noted the importance of following a healthy lifestyle and exercising to maintain muscle strength and bladder health. Muscle damage. The occurrence of urinary incontinence in many cases is due to the exposure of the muscles located at the bottom of the pelvis to damage, and this occurs after pregnancy and childbirth, or undergoing surgical operations such as hysterectomy. Urinary incontinence treatment. you need to know that it is an easy disease to treat after its diagnosis and distinction of its type. The treatment of recurrent urinary infections is considered half of the treatment in the nervous bladder, as well as special exercises in the pelvis to strengthen the pelvic muscles are also half the treatment of true incontinence or stress incontinence. These exercises are done by holding the pelvic muscles as if you were preventing urine, stool, and this exercise is repeated for 10 seconds and repeat 5 to 6 times a day or whenever you remember that at any time and anywhere, and this exercise can also be applied during urination, which helps in the growth of the responsible muscles and tightens the neck of the bladder. During this treatment, it is preferable to record on a sheet of paper the number of times of urination, the number of times the possibility of urine control, and the number of times that you cannot control urine, i.e. incontinence occurs. And if the treatment by conservative methods, medications and exercises, is not responded to, we resort to surgery, which is by raising the bladder, its neck and the urethra towards the pelvis, by suturing the tissues around the urethra and the neck of the bladder to a ligament called Cooper and suturing Kelly's stitch, below the pubic fracture, which are operations that require an overnight stay in the hospital for several days after the operation, to ensure its success and the absence of complications. He has recently invented a new method, which is the use of a tape made of a material that the body does not reject, polyproline, which is inserted from under the urethra and fixed under the skin, either in the skin of the pubic or thighs, according to the operation. It has achieved many successes in terms of curing symptoms so that the presence of the tape under the urethra works like a plug that prevents urine from escaping when the pressure inside the abdomen rises during coughing or sneezing or carrying heavy objects. In addition, that the operation does not need to stay in the hospital for a long time, as the patient is discharged on the same day operation or a day later. Last but not least, there is no disease without a cure, so there is no need, my lady, for a person to remain in torment because he cannot reveal the pain that haunts him. Thank you for watching the video. Please subscribe to the channel, press the like and bell button to receive each new video.